Akibat sa Fourth Industrial Revolution ang pag-unlad ng teknolohiya na naglalayong pabilisin, paginhawain at pagyamanin ang buhay ng bawat Pilipino. Dahil dito at sa paglinang ng talento at husay ng imahinasyon ng tao, unti-unti na itong napapabilang sa ating pang-araw-araw na kabuhayan. Higit sa lahat, ito ay kasama sa layuning pananaliksik ukol sa mga solusyong pangkalusugan. Isa na sa mga pinakmagandang ipinagbunga nito ang programang Digital and Frontier Technologies for Health na napapasailalim sa Philippine Council for Health Research and Development. Ang layunin ng programang ito ay magbigay ng epektibo, mura at pangsangkabayanan na solusyong pangkalusugan sa pamamagitan ng paggamit ng makabagong teknolohiya upang mas maraming Pilipino ang makinabang nito at maging abot kaya. Sa kasalukuyan, ang pangkat ng programa ng Digital and Frontier Health Technologies ay binubuo ng pawang mga kababaihan. Ang programang ito ay dating nakilala sa tawag ng Information and Communication Technologies in Health, ngunit sa patuloy na pag-unlad ng makabagong teknolohiya, ang programa ay nagpalit-anyo rin at lumawak ang sakop na kasamang Artificial Intelligence. Kaya ngayon ay tinatawag na itong Digital and Frontier Health Technologies Program o sa mas maikling pangalan, Digital Health Program. Sa Digital Health Program, ang mga prioridad na paksa ng pananaliksik ay ang mga sumusunod. Artificial Intelligence sa pangalaga ng kalusugan na gumagamit ng pagsusuri ng datos. Artificial Intelligence sa mga aplikasyong pangkalusugan. Pagsusuri at pag-unlad ng mga serbisyong pangkalusugan na may kinalaman sa Information and Communication Technology at seguridad proteksyon para sa ating Health Information System. Sa kasalukuyan, ang mga proyektong ito ang ilan lamang sa mga matagumpay na naitaguyod at napondohan ng programa. Ilan lamang ito sa mga natatanging proyektong sinuportahan ng PCHRD upang itaguyod ang epektibo, patas at murang solusyon para sa ating healthcare system sa pamamagitan ng makabagong imbensyon at teknolohiya at na naglalayan din na makatulong sa mga mamamayang Pilipino upang mas maging accessible at maayos ito para sa lahat. Maliban sa mga proyektong nabanggit na lubhang nakatulong ngayong pandemya sa pagkamit ng serbisyong medikal, nagpapabago at magpapabago pa sa hinaharap sa sistemang pangkalusugan ng ating bansa, at dahil na rin sa patuloy na pag-unlad at pagkilos ng makabagong teknolohiya, nakapanayam din namin ang ilan lamang sa ating mga doktor na siyentipiko at dalubhasa tungkol sa kanilang palagay sa mga makabagong teknolohiya na sa tingin nila ay higit pang makatutulong sa patuloy na pag-unlad ng pagsasaliksik sa Digital and Frontier Health Technologies.
In 10 years' time, I envision that there will be wider utilization of digital health technology in the entire country. This digital technology will have a bigger impact, particularly in bridging the gap between the service providers and the end users. Accessibility towards assessment, screening, and referral, provision, aftercare, and health monitoring will be more integrated. I also see telemedicine being widely used in the entire country. And telemedicine will be utilizing integrated information management systems across different institutions, not only healthcare facilities, but also government agencies. Because it is very essential that we have enablers. Enablers such as transportation. It should also have features of accessibility. Enablers such as livelihood, employment, and education. Because the service providers and the end users might know very well how to use and what to do with digital technology, but the conduit by which one would access the other is deficient. And this would now be your transportation, your employment, your education framework. So I looked at digital health technology to be paving the way towards linking the service providers to the enablers and to the end users. Mobile technology and wearables have played a very vital role already in monitoring health data and facilitating access to health services. We have your voice-activated mobile phones and wearables for our visually impaired. We also have our captioning for our hearing impaired. And so, within the next 10 years, we look at more digital health interventions with significant benefits, particularly for persons with disabilities. Therefore, it is very important that government, science and technology should invest heavily in digital technologies for health, because as a means by which persons with disabilities will gain access, this would play a role to ensuring that no Filipino will be left behind.
So 10 years is medium term, no? And ako, I tend to think of long term. So more than 10 years. Particularly because yung mga digital health solutions, they take time, no? Kailangan mong i-implement yan, tapos titingnan mo kung maa-absorb ng mga tao or kung magugustuhan nila at merong uptake. So over 10 years, I do see our health system to be more digitalized. So meaning a lot of the doctors, the health workers, and the patients are using digital health tools to aid in patient care. But I also see our health system to be starting towards the journey towards a learning health system. So learning health system meaning yung nakukuha natin na lessons from, how our health system is evolving, we keep feeding it forward to adopt new practices that will keep improving our population's health. So that's what you call a learning health system. And a learning health system is aided by how we learn or what we learn from the previous practices. Ibig sabihin nun, kailangan ng data, no? So yung data, that is what makes it possible for us to figure out if the way we set up our health system is good or it's improving, or maybe it's not responding well, no? So makikita natin yan, how we set up our data system, collect the data, then analyze the data, and try to use it for continuous improvement. So I want to see a health system that learns, from how it's set up and how the outcomes are coming out, and to continuously learn, to improve patient care. So that's how I see it. And I think digitalization is part of that solution. Kasi nga, if we do it without digitalization, mabagal. So that 10 years will probably take, much, much longer if we do not adopt digital health solutions. So I see our health system digitalizing and also continuously improving and perhaps accelerating that improvement towards better and better healthcare, once it as digitalization is put in place. So yun yung nakikita kong vision natin. So maybe parts of it can be achieved in the next 10 years, but I think this is more of a long-term vision where, even maybe within 10 years, we would have already digitalized, but we need to continue doing that, no? To be able to reach yung ating geographical limitations, kasi digitalization also has that limitation. There's so many islands. We're not necessarily able to digitalize all of our healthcare systems that exist in some of these islands. And sometimes those islands don't even have healthcare systems, so they have to travel to the main cities where the hospitals are. So I want to see using digitalization, the healthcare system reaching the farther geographical areas that currently are not being served. So ito yung mga underserved areas.
I think because we are all following the same strategic plan, the 10-year strategic plan based on the Universal Healthcare Act and based on the National Integrated Cancer Control Act and their strategic plans, and also because we are all over the world hoping to achieve the United Nations Sustainable Development Goals by the year 2040. I think that in the future, in 10 years, we will all be much closer to our vision of universal healthcare, meaning we will have not just the healthcare workers or the healthcare administrators or those involved in the healthcare system working towards better health for all, but even all the other members of the ecosystem, of the healthcare ecosystem, non-doctors, non-nurses, and especially those involved in health technology. We will all be working together in an all-of-society approach towards better healthcare for Filipinos. And in particular, because of our very rapid advancement in digital health, I believe that in 10 years' time, even though a lot will be much improved, the biggest improvement will probably be in two things: in communication and in data access, data acquisition and data access. And so that is what we are all looking forward to. I might be retired by then, but hopefully those who are going to come after myself, the next generation of healthcare stakeholders, have this to look forward to.
In my opinion, there should be more efforts dedicated to enhancing access to health services in the country through digital technologies. Digital technologies should also play a role in supporting community-based efforts in the country. These technologies have a potential to enhance the capacity not only of local health workers, but also the caregivers and their families in screening, assessment, provision, aftercare, and monitoring of health services, considering the limitations in resources around the country. Specifically for disability and rehabilitation, I hope we will be able to use AI or artificial intelligence, machine learning, and other digital interventions to enhance not only functional independence but also safety in use of persons with disabilities. In the past decade, we had already several assistive technologies that have been developed and have increased the potential for persons with disabilities to experience independent living and participate in societal activities. So hopefully, through research and development, we'll be able to explore more potential and applicable technology that can further improve the lives of persons with disabilities towards inclusion. Hopefully, these technologies will also minimize the impact of disability in their lives and provide opportunities for participation.
Digitalization certainly, as I said, will help, us achieve, our goal of improving our healthcare system, getting to the point where our healthcare system learns from itself. Pero we need to lay down the foundations for digitalization. Unang-una, yung having internet, in places where it's not reached, or having stronger signals. So these are the empowering technologies, that would help us. So having a good internet signal, wherever we want to have healthcare, our healthcare system, to go. So tapos beyond that, kailangan na ng mga empowering, additional empowering technologies such as transitioning from paper records to electronic, and also telehealth, because with telehealth, which we're actually doing at the University of San Agustin at the Center for Informatics. With telehealth, and with all of those other foundations such as the internet signal, reaching places, farther and farther places, more isolated places, telehealth can reach our people, no? So, tapos, as I said, kailangan mag-convert tayo to, from paper records to electronic medical records, kasama na dun yung telehealth. So, integrate telehealth into the electronic medical record system. Tapos, as we analyze the data, we will, generate evidence that will improve the way we practice healthcare, or the way the way we care for our patients. No, so we will have that data, and then we can inject it into those technologies, no, such as in clinical decision support, which can be included in electronic medical record systems or EMRs, as well as in telehealth. No? So parang yung mga clinical decision support will help our doctors and our nurses care better for our patients. Kasi nga, nare-reinforce ng mga clinical decision support yung mga guidelines that are being rolled out by our healthcare bodies. So clinical decision support are actually, codified into some of these empowering technologies such as electronic medical record systems or in telehealth na napoprogram itong mga clinical decision supports. And these clinical decision support comes from the guidelines that are coming from evidence-based, that we also get from the data that we're getting from, these digital technologies. And beyond that, kunyari, marami na tayong So, okay, we need data, di ba? We need data to learn more about how we do healthcare so that we can improve it. So, itong data na to, mako-collect din ito from, having electronic medical records or patient registries, or these databases that, research databases that will allow us to, improve, patient services, improve guidelines. So, kailangan na din natin ng data repositories, perhaps clinical data repositories where we can conduct research, no? And these data repositories can be generated from, data that already exists, maybe from paper, where you take the data from the paper records, the patient paper records, and digitalize them, no, to create patient registries. Pwede naman kung malawakan na yung ating electronic medical records, we get that data from those records and put them in a clinical data warehouse. So, magkakaroon tayo ng sources of data. So, the other sources of data na pwede natin gamitin for research. Pero kailangan itong data resources na to, concerted effort. In other words, everybody contributes to it para mas kumpleto yung yung ating picture ng ating patient services. The other thing that would help us, no, pag kunyari meron na tayong maraming data, would be advanced computational methodologies, such as bioinformatics, for example, particularly if we have the omics data in our records. That's a movement now that's going on in other countries where genetic and genomic records are also moving into those electronic medical records. Hindi lang yun. We can also do machine learning, lalo na kung marami na tayong data na na-accumulate, no, from our enabling technologies. Pag marami na yung data, big health data, kumbaga, then we will be able to use machine learning or artificial intelligence, to further improve our health services and also codify, those health AI, ang tawag dyan health AI, to further codify them in those enabling technologies such as telehealth or electronic medical record systems. Beyond that, we also have movements now where health is being conducted via apps or applications. And this is very evident in mental health. So in fact, there's already a proliferation of applications that individuals, even without, consulting their doctors, actually use, to care for their mental health. Ang issue lang dito is regulation, no? We have to have evidence that shows that these apps actually work. So dapat meron tayong bodies that would regulate na, if an app claims that it can, help with mental health, then dapat merong evidence yan and dapat meron tayong regulatory bodies that actually like study that evidence. So, and I think some of those bodies are actually in existence dito sa Pilipinas, no? Health technologies, I think. But as far as, for example, maybe evaluating health AI or, you know, mental health applications, maybe we need to catch up on those things. So, marami akong recommendations, no? What digital health tools? So, first, digital health technology that gathers the data, you know, to put a baseline so that we can study our healthcare system. Second, empowering technologies such as electronic medical records and telehealth, no? And then computational approaches, because once we have those empowering technologies, we'll have a lot of data. Advanced computational methodologies such as bioinformatics, for example, when we have omics data, particularly if we, you know, start collecting, you know, if those become affordable, no, those omics procedures, and AI/ML. AI/ML is so AI, artificial intelligence, ML, machine learning. These are even more applicable. No, they're probably less expensive than omics data. So we can definitely take advantage of the developments in machine learning and artificial intelligence, apply it to our health data, and then generate evidence for improving our healthcare.
I think what we really need is better public education, better access to health. And then the question becomes, what are the tools, technology tools that are needed to improve public education and to improve access to healthcare? And then the answer, I think, would be not necessarily technology, unless we can use technology to create teaching modules, for example, that will reach the end users of healthcare. Meaning, lahat ng patients, kahit malusog pa sila, kahit maliit pa sila, natututo pa lang sila mag-alaga ng sarili. Kasi disease prevention and self-care require a healthy lifestyle and a knowledge of what it is that you can do for yourself so that you will maximize your health and prevent illness. Because that is really the most accessible. All the other things, for example, diagnosis, and I speak of cancer because I am an oncologist. For example, to diagnose difficult to diagnose cancers, you might need high-end PET CT scans, or you might need special biomarkers that research and development spends so much on, and so therefore need to recoup their cost, and so therefore it's passed on to the end user. And or for treatment of cancer, wherein you need a proton scan or a gamma knife machine, or you need immunotherapy that costs hundreds of thousands of pesos every 3 weeks for the rest of your shortened life. These are expensive things that really, I think, are obviously inaccessible. That technology was used to develop, but really it's not going to help a whole lot of people. And the greatest volume or the greatest number of people who will be helped will be reached by giving them access to education on how to live a healthy lifestyle and disease prevention, on how to do screening tests for screenable cancers, for example. These are simple tests. These are not expensive. And yet, unless people know to do it or change their behavior and do a mammogram once a year or do a stool test once a year or undergo pap smear once a year in order to capture disease if and when it happens and save lives that way. Unless we teach the people that this is how they're supposed to, or this is for their own benefit if they behave this way, and in fact is the most cost-effective approach to good health, unless we teach them that, it's not going to be very useful. What tools are needed? Again, I go back. Teaching modules, teaching tools, internet, access to internet. These are all already available, but perhaps can be made more available. The other thing we can do is to open up all the data. First, gather, organize, build robust databases that are properly curated and monitored, analyzed by those who are trained to analyze, and then use whatever is discovered through analysis, publish the data, and use that published data to make even more research studies, to help even more patients, to level up healthcare. So to me, that is the role of digital health, and that is something that we can maybe spend a little bit more money of the people on in developing these technologies, because it's going to redound back to them.
Ngayon at narinig na natin ang saloobin ng ating mga katuwang na mananaliksik, nais namin ibahagi ang roadmap ng Digital and Frontier Health Technologies Program, kung saan nilalahad namin ang mga planong research priorities ng programa sa susunod na 10 taon mula 2022 hanggang 2032. Binuo ito upang matugunan ang umuunlad na pangailangan ng ating healthcare system o sistemang pangkalusugan ng Pilipinas, habang itinataguyod ang pangailangan ng research at development sa aspeto ng digital health. Alinsunod din ito sa global competitiveness ng sistemang pangkalusugan ng bansa na isa sa mga prioridad ng NURA. Sa susunod na 10 taon, naglalayan ang Digital Health Program na magpatupad ng mga research initiatives tungkol sa mga sumusunod: R&D Program on Health Data Interoperability and Use, R&D Program on Renal Health, R&D Program on Social Media Analytics, R&D Program on S&T Applications in Criminal Justice. Mayroon din kaming research priority areas na ipapakilala namin sa aming katuwang na mananaliksik at dalubhasa na tiyak na makakatugon sa mga pangangailangang pangkalusugan ng bawat mamamayang Pilipino. Projects on Artificial Intelligence in Healthcare Applications. Projects on Assessment and Development of ICT-enabled Health Delivery Services. Program on Clinical Analytics and Decision Support Technology for Health Information Evaluation and Monitoring. Project on the Development of Data Compression and/or Automated Data Transmission Algorithms to improve data exchange in telemedicine. Projects on Artificial Intelligence in Healthcare empowered by Data Analytics. Project on Space Technology for Pandemic and Resilience. Program on Smart and Robotic Physical Rehabilitation and Assistive Devices. Project on Technology-Assisted Surgery for Patient Safety. Project on Clinical Validation of AI Wearable Device. Project on Sensors, Wearables Involving Artificial Intelligence. Ilan lamang ang mga research programs na nabanggit na inaasahang makatutugon sa mga pangailangang pangkalusugan ng bawat Pilipino. Ito'y kaakibat ng 4th Industrial Revolution na ating inaasahan ay magdadala pa ng higit na mas maraming pagbabago sa teknolohiya sa hinaharap. Sa huli, sa pagpapatupad at pagsuporta ng mga magiging kinalabasan ng research initiatives ng Digital Health Program sa sistemang pangkalusugan ng Pilipinas, inaasahan natin na ang serbisyong pangkalusugan ay magiging mura at abot kaya at maliit ang aasahang gastusin mula sa sariling bulsa. Patas ang pagkamit at pamamahagi ng serbisyong pangkalusugan at medikal kahit sa pinakaliblib na lugar. Mabilis at epektibong proseso sa pagkamit ng serbisyong medikal at pangkalusugan. At higit sa lahat, nakakamit at lubos sa tumutugon sa pangailangan ng bawat Pilipino sa pagkamit ng serbisyong pangkalusugan o medikal at sa pagpapalaki ng kapasidad ng ating mga healthcare workers. Isa lamang ang Digital and Frontier Health Technologies Program sa mga research and development programs ng PCHRD na naglalayong magbigay ng solusyong gumagamit ng mga pinakamakabagong teknolohiya upang mapabuti at makatulong sa kalusugan ng bawat Pilipino.